One of the questions that is, I think, really important for somebody listening or watching is, what would you want a patient to ask you, or what is important for them to advocate for themselves with another doctor, before they get care or during their care?
I would say, it's good for a patient to get across what their story is and what their concerns are. Sometimes it takes a little while to get to that point. Are they recovering from, a hard situation, such as their husband passing away a year or two ago? What's their living situation like? What are the things that affect their health that they're concerned about, and what are their priorities? Everybody has a slightly different view of how they want their health care to go and what their priorities are. And it's good to get a doctor that focuses on not just getting things done for the immediate medical issue at hand, but also takes a broader view as far as what are the patient's priorities.
Yeah, that's really interesting because, a lot of people say you're your best advocate. So, tell the story, make sure that you're front and center in your journey as well, not just the doctor, right?
Right.
Awesome. So in your opinion, do you think what has changed in the healthcare field over the last 5 years, whether that's good or whether that's bad? Do you have any insight on how much it's changed?
So I've seen some change with regards to insurance and accountable care organization and those types of organizations and how they relate to us in the primary care field. Payments have changed, for sure. The requirements upon doctors and the types of things that are followed through these organizations have changed. Can
you explain that a little bit more for me? I don't know what those organizations are per se.
So an accountable care organization, it was created through Obamacare, essentially. And so what an accountable care organization is, from my point of view, I'm not an expert on it, is basically it's a set of doctors, say hospitals or groups and specialists that come together and say, okay, we're part of this accountable care organization. We are going to take care of a set of patients, and we ultimately are going to provide quality care, and also we're going to provide that care at a lower cost.
Okay.
By not replicating tests, by not having readmissions and hospitalizations, things along those lines. So that's the idea behind an accountable care organization, is coordination of care, so that it's more efficient and also less costly. And so it started with Medicare, or they are Medicare programs, so that part of the money that's saved for Medicare is then returned back to the accountable care organization and then shared with with doctors, particularly primary care doctors, since we're the quarterback in this whole thing. So there's been a lot of changes with regards to the ACO programs and also the Medicare Advantage programs that kind of go along with those, which are the Medicare Advantage is the commercial offering of Medicare. Is the best way that I could see it. So, I mean, without going into the nitty gritty, there's just been a lot of changes in that front, and we've had to change along with it. And, in the last 5 years, we've had the pandemic, which was a huge thing as far as changing how we deliver care through televisits. And also, it's kind of spurred on a lot of other changes as far as access to care and things along those lines.
So would you say, is it make it harder for you, or is it kind of both as a doctor?
So there's some things that have been easier with regards to COVID spurring on like more televisits. Those are covered now all of a sudden, whereas before the pandemic they weren't. That was the only way we could deliver care. So that was a good thing that came about.
Yeah, no, that's great.
But not so good things are kind of insurance companies and Medicare kind of cutting back on payments, and our costs of running a practice going up.
Yeah.
Therefore, a doctor has to see more patients in order to cover costs as compared to previously.
Interesting. So we could probably go on for a little longer. I have a lot more questions.
Yeah.